Today, we will discuss a very important topic. How can we reduce the cases of vaginismus, which are commonly seen in Muslim societies? And why is it so prevalent in Muslim countries? Let's talk a bit about these issues. Vaginismus is a common issue among women. It arises due to fear and anxiety towards the first sexual intercourse and the beginning of sexual life after marriage. This fear and anxiety lead to muscle contractions at the vaginal entrance, preventing penetration. It is the most common disorder among female sexual dysfunctions. So, why is vaginismus more prevalent in Muslim societies? Factors such as the increasing age of marriage and the prohibition of premarital sexual relations in Islam play a role. Over the years, young girls often hear negative statements about sex and men, which leads to what? This causes the woman to mentally encode her first sexual experience not as a pleasurable one, but as a painful event that could send her to the hospital and violate her privacy. It leads to the development of more hostile feelings towards men in a holistic way. She distances herself from her own body and from her femininity. One of the most important reasons for the development of this condition is the exposure to frightening comments about the hymen and the first sexual experience. Constant fearful comments about bleeding, pain, and the breaking of the hymen from mothers, aunts, close relatives, neighbors, and friends can make the first sexual experience seem impossible in the subconscious of young girls. So, how can we reduce vaginismus? That is the main issue. First of all, there are many couples who experience traumatic sexual intercourse without any prior education. Exaggerating and carelessly sharing these experiences only spreads the problem rather than reducing it. Social media posts, exaggerated descriptions, and unrealistic statements have made the first sexual experience seem even more frightening, traumatic, and impossible in the minds of women who are about to marry. We can prevent vaginismus in two ways. Firstly, it is important for married women to adopt a constructive attitude. They should positively describe sexual intercourse to young women who are about to get married, embrace their sense of femininity, and emphasize that pleasure belongs to both men and women. Young women should be taught that they will not suffer in marriage. On the contrary, they will have the wonderful opportunity to experience sexual pleasure and enjoy the feeling of motherhood. When all the positive aspects of marriage are explained to our young girls, and even our sons, their desire to marry will increase, and concerns such as avoidance of marriage, fear, and anxiety will diminish. Therefore, married women should not pass on their traumatic experiences to the youth. And if they have had their own mistakes or negative experiences, they should refrain from using them as examples for others. So, why do wrong relationships occur? It's because, due to a lack of education, the number of couples who get married after receiving sexual education is very low. In many surveys I have conducted, not a single person reported getting married with proper sexual education. Other segments of society consider sexual education unnecessary and believe they can be very relaxed about it. However, many anatomical problems can be encountered. For example, there can be issues such as the presence of a band on the hymen, narrowing, thickness, or even a short vagina. Additionally, there can be cases where a double vagina exists, and attempts are made to enter through a narrow area. Due to anatomical abnormalities, couples may encounter such issues in their marriages. While single, individuals do not consider undergoing a hymen examination or questioning whether they might experience any problems once married. When this situation is suddenly encountered, the tearing of the septum can lead to severe bleeding. However, if a prior examination had been conducted, and proper education provided, such a traumatic experience would certainly have been avoided. What's even worse is that they normalize the traumatic nature of the first sexual encounter and the resulting bleeding, when in fact, such trauma is not normal and should not be accepted as such. Even a small amount of bleeding becomes an issue in the minds of some men. They think, "We expected more bleeding, but my wife bled very little. Could something be wrong?" Essentially, what they're really asking is, "Isn't my wife a virgin?" Or, "Has she had sexual intercourse before?" Instead of focusing on making their partner happy, achieving mutual pleasure, and having a beautiful beginning, they fixate on concerns like, "Is she a virgin?" and "Will she bleed excessively?" On the other hand, a woman is starting her sexual life with thoughts like, "If I don't bleed, will I be defamed? If I bleed only a little, will it be misunderstood? And if I bleed too much, will I end up in the hospital?" As you can appreciate, entering a sexual relationship with such thoughts makes a healthy and fulfilling experience nearly impossible due to the lack of sexual education and the absence of gynecological examinations. Since many people consider them unnecessary, hospitals often receive cases resulting from traumatic sexual intercourse during the wedding season and on weekends. These cases typically involve issues such as bleeding, ruptured blood vessels, or tearing, all of which require repair. However, we want our young girls to experience their first relationships beautifully, achieve emotional fulfillment, and avoid the development of a traumatic environment. So, is this possible? Absolutely it is. Because if you understand your anatomical structure, if you have learned how to act as a couple, and if you do not harbor any trauma-induced fears, you will not only achieve hormonal balance, but also enjoy beautiful foreplay, relaxation, proper breathing, and mutual synchronization. Therefore, in Muslim societies, we can reduce the fear and anxiety we refer to as vaginismus by first implementing regular adolescent education during puberty, and then, prior to marriage, by providing a comprehensive sexual education program. Participating in such programs, reading relevant books, seeking help from doctors, and undergoing necessary examinations. I must also say this. I advise all our girls and boys who will engage in sexual activity that education is the foundation of everything, and science is the basis of everything. If you do not view the human body and sexual organs as fundamentally different from other organs, and if you consider acquiring knowledge about them a natural necessity, then when you take steps in this direction, you can be sure that your first sexual encounter will be a wonderful experience. I wish for all our future married women and men to experience the most beautiful relationship, quickly attune to one another, share orgasm in every sense, and enjoy the most fulfilling sexual life. I conclude this video, and I hope it has been beneficial. For the sake of the future, for the new generation, may traumatic sexual encounters come to an end. Vaginismus cases should gradually decrease to the minimum. Goodbye.